Welcome to Chamber Chats. I'm Priscilla Monti, Senior Vice President for Programs and Communications with the Hampton Roads Chamber. The Hampton Roads Chamber means business in good times and in bad times. And one of the things that has come out during the pandemic is that mental health is a very real issue and we need to talk about it. And it impacts business. Millions suffer from mental health issues, and that does affect a business's bottom line. It affects absenteeism, it affects productivity. If your employees are in a better mind space, they'll be in a better workspace, right? So joining me, we have a couple experts here. We have Kurt Hooks, who is the CEO of Virginia Beach Psychiatric Center, and Dr. Cynthia Romero, Director of the M. Foscue Brock Institute for Community and Global Health at EVMS. Thank you both so much for joining me.
Thank you.
So we're just going to start off. We'll start with you, Cyn.
Sure.
Let's just start off telling a little bit about who you are and what you do, and you know why you are an expert in this field.
Sure. Thank you so much, Priscilla. So through the pandemic, EVMS has really pivoted to adapt to the community's needs. That's what we are. We were built by the community for the community to not only provide the workforce for the region, but also to address and engage the community, understand their needs, and deliver. And I'll say, in addition to our clinical care that we provided through our medical offices, advanced research, particularly focused on health disparities in COVID-19, I'm proud to say that EVMS pivoted to allow our students, our medical and physician assistant students, to be trained in delivering COVID-19 vaccinations to the most at-risk populations throughout Hampton Roads. And we've partnered with healthcare delivery systems like Centera and Chesapeake Regional, as well as the Health Department, the Virginia Department of Health, and pharmacies like Hague Pharmacy and People's Pharmacy, and so many community groups to allow our students to, number one, serve the community that are really most at risk for getting sick, but number two, to be able to be part of this life-saving effort to transition us back to normalcy by delivering the vaccine. And from January to now, our students have helped deliver almost 47,000 vaccinations across the region.
Thank you. And that is how we are going to get back to normal. That is absolutely.
Exactly.
So Kurt, how about you? Tell us a little bit about your background with the Virginia Beach Psychiatric Center.
So I actually started my career as a young clinician 21 years ago at that facility, and was fortunate to have worked my way up through the ranks for a period of time, and then I was able then to kind of pivot. I decided to pursue a couple more degrees in public health, and I have a terminal degree in counseling, and about 2 years ago was invited back into this place that I started my career. I was with Chesapeake Regional Healthcare System for quite a while, but I've always had a really special interest in now more so probably than ever in the context of all we're talking about, for the intersection of an integration of behavioral health into the larger umbrella of healthcare, and also the social determinants, all the things that impact all of our systems, which are made up of people that work at our businesses, for example, here in Hampton Roads, our flourishing businesses. And all of that, as you mentioned earlier, segues into the discussion about thinking about, okay, how is this impacting the performance of our businesses, and what that really boils down to is how healthy is our workforce. Mm-hmm. Behavioral health is a really important component of that.
Well, one of the things that I love about both of you, and when we were discussing having this as a topic for Chamber Chat, your names popped immediately, is that you've both brought it out, and you're both talking about mental health openly. Kurt, you stood up at a couple of our chamber events and asked questions of senators and congressmen, and you know, brought it out there, get them talking about it. And you know, I think that some of that is from the pandemic. We realize that mental health is a critical issue now, and so moving forward, maybe that's what we need to really start talking about it. So as business owners and business leaders, what do you think it will take? What do we need to do to get them talking about it and finding solutions?
Absolutely. Well, I will say two things, Priscilla, that businesses and business leaders can do today. Number one is recognize that the pandemic has impacted everyone, mentally, emotionally, financially, economically. They've just impacted everyone differently. And for business owners to really start to think about the culture that they're creating through their leadership, not only themselves, but also throughout the organization, to be able to normalize these conversations. But number two is to identify and start listing what resources they have internally and where within the community they can help refer their employees and even family members that may be expressing some needs that they have. And again, knowing that the pandemic has really impacted people differently, there were people who were disconnected and suffering from mental illnesses, anxiety, depression, substance use disorder before the pandemic. And then with the pandemic, it's really exacerbated all those issues. So where do we allow them to be able to get supports? And I think we've been really working so collaboratively with so many partners throughout the community to identify where are the low and no cost options within the communities, but also how to encourage the culture to be able to say it is all right to express that it's a difficult day, or mentally, you know, I'm thinking about issues that are happening at home with my kids and loved ones.
Well, and Kurt, you know, you get into that fine line, you know, as a boss.
Sure.
Can I say, hey, you seem a little off today, is everything okay? You know, yeah, I can say that. And then if the worker says, yeah, I'm fine, dealing with some stuff, and doesn't want to open up, you can't really push.
Sure.
So, I mean, how do I create a sense of the, you know, the colleagues sort of checking on each other?
So I'm going to double down on a lot of what Cyn had to share, and I look forward to talking more actually offline after this as well. But how do we make that okay? So I think we model it as leaders, and this is very difficult to do as leaders of organization because there's a lot of responsibilities upon us. So when is it okay for us to step away and to message to others, normalizing it? So how do we normalize that it's okay to have that conversation? Well, first of all, maybe we want to talk about a wellness committee for our business, and if many I know have their own version of that, maybe we need to talk about sit down and message. I think it starts with a very clear, fundamental, consistent message that it's not a sign of weakness or some moral failure. If you have a mental health issue or a substance use issue, that is equivocal to someone having a major medical problem, for example.
Right.
We talked about this earlier before the interview, a cardiac issue, cancer, some of the outcomes, morbidity and mortality outcomes we see associated with serious mental health issues are commensurate with what we see with a lot of serious medical issues, but we silo that in our minds differently, and we have a very pregnant moment now where we have some people talking out about that. So I think we utilize that tailwind and we become united in our collaborative efforts to our messaging, that awareness, it begins there, and then the resourcing needs to fall behind that.
Right, and I'll just simply add as well that the idea of self-care,
Yes.
where business leaders,
Yes.
especially those at the highest level, need to think about how to go about really assuring that self-care is incorporated, and then fostering that throughout the organization, whether it is a CEO or whether it's someone taking care of the trash, or just the closing and wrapping up of the business. Everyone throughout an organization really needs to be supported and encouraged to focus on self-care. And how do we continue to offer resources to be able to do so?
We are in a point where a lot of people are coming back to their offices for the first time in 18, 20 months.
Mhm.
And the dynamic is different. And how can leaders and colleagues, how can they make that transition easier for everyone? I mean, that's a long time to have been working alone and having that sense of isolationism and all of that. And so, how do we make that easier?
And I'll say a couple of things. So coming back to a space, and now we're still in a pandemic, right? And we're still seeing the Delta variant and other variants start to impact us, so we're not quite able to
Well,
get
and that
100%.
uncertainty is a whole nother
exactly.
level of anxiety.
Exactly, so I think having the discussions, of course, with all the leaders and planners, to recognize that even if we're doing this socially distant, hand sanitizer, effort, recognizing that there's gonna be a lot of fear and anxiety to be able to do that, and how to address that proactively, and maybe even asking who's feeling comfortable coming back, and what would it look like for you to feel comfortable coming back. Some people may love to be back in the office, but may be uncomfortable participating in a small conference room, right? And so how do you maybe accommodate the physical space? But I think just acknowledging that everyone coming back to a physical space is going to conjure up fear, anxiety because of uncertainties now. So I think talking it through and really having the leaders engage their employees to say, what would you guys like to see as we're planning this over the course of the next few weeks, few months, and next year.
We all watched Simone Biles and Naomi Osaka say, I can't perform my job, my head is not where it needs to be. I was cheering louder than anyone for both of those young women because they had the courage to do that. Does that open the door now for others to have that courage?
I think it does. The more that type of someone with that status, respect, and fan base from really any domain, sporting, obviously, we think of the entertainment industry. Mm-hmm. We've seen a lot of examples there. In all sectors and domains of life, if we have individuals, especially in prominent places, who are willing to step up and just say, I'm not okay, and it's okay for me to say that, and in fact it's a healthy thing. It demonstrates a level of self-awareness that I think we can foster, and it signals to others that there is that line for all of us, and it's okay for us to find that within ourselves and then share that with others. And to your point, I think it was just phenomenal what she did, what some other athletes have done recently, and my hope and prayer is that this will keep things moving not just in an awareness direction, but in something actionable. Mm-hmm. to concurrently follow alongside of that. So it's one thing, and it's fantastic to talk about it. The next step is, okay, what kind of concrete things can we do to really integrate this different type of mindset into our businesses, into our families, into all these spaces that we occupy.
And your first instinct before the pandemic, if someone was having a hard day, you'd say, let me give you a hug, yep. Right? You can't necessarily do that. So as we wrap up, what are just some concrete things that we can do for each other, because we are all in this together, and you both are leaders in your field, and you have staffs that work with you, you have families that depend on you, you have a sick dog that you're eager to go take care of,
Yes.
So we've all got everything going on in our minds. What can we do? What's right away?
I'll go back to the self-care. I think all business leaders now really need to focus on how they can focus on self-care for themselves and how they can foster self-care that'll lead to productivity with their employees. I recognize that there are so many services and supports and organizations throughout Hampton Roads that are doing this every day. They're teaching workshops about self-care. They're teaching strategies on how to cope with anxiety and fear and uncertainties. And I think it's just a matter of having organizations plan ahead and see what they can do to foster that kind of environment.
I agree with that completely. So having a cultural understanding of your unique organization, knowing what tools are available out there, and I'll just share an example. For our facility, we have a long-time tenured one of our psychologists who helps with our commitment hearings that we have at the facility. Been a good friend for many years. He put together a resilience module that he's been working through with our direct care staff, and he knows our facility and he knows our staff, and that just, I think, makes it even more meaningful. So I think understanding what tools are available and the education around wellness and what that consists of, the modeling, and then actually walking that out in a meaningful way to the people that are throughout the organization ideally, but especially those who are most vulnerable perhaps to be impacted by this.
And pay attention to each other. Yeah.
Yes.
And so
Exactly.
most insurance carriers have some sort of an EAP program, employee assistance program, that is confidential. It does not, you don't get a ding on your record at work if you use the services. Usually there's no cost with your insurance provider. And it is just a way that, especially small businesses, can provide a resource for someone who needs some help, and they will, if it's realized that, this is much more than 4 sessions can handle, they'll refer you to more treatment and that sort of thing. I think the most important thing is that we can all just be aware.
Yes.
Thank you both for what you have done, not just today, but over the last 18 months to really bring this out and get people talking in Hampton Roads about mental health and business, because if your workforce, it's more than just a happy workforce. You want a healthy and mental health is critical. So this is a much bigger issue than we can do in this little chamber chat, but this is just to get the conversation started. And so, we will have some links to some services that will be linked right to this chat that you can click on. Always reach out to us if you need some information on services that are available, and we can connect you to both of these two wonderful experts in the field. Thank you for tuning in for this episode of Chamber Chats. We'll be back in another 2 weeks. Thanks.